us our support today by being here. So let's start with our formal function, our press meet. We are here to share the early outcomes from Goa's AI-enabled lung cancer program, which is now crossed 1 lakh chest X-ray reviews within the public healthcare system, which is a huge milestone, and we take immense pride in making this happen alongside the Health Ministry and AstraZeneca. As we meet on the eve of World Cancer Day, tomorrow is World Cancer Day, this is a milestone that offers an important opportunity to reflect on how early detection can be strengthened at scale using infrastructure that is already within our systems. Today's briefing will outline how artificial intelligence has been embedded into routine chest X-rays across government health facilities in Goa, enabling the identification of lung abnormalities without additional tests or patient visits. We will also hear from the government of Goa on how this program is being implemented within clinical workflows and what it means for public health going forward. To begin with, I would like to invite Ankit Mori, founding member and Chief Product Officer of Triaging, to offer a brief welcome and framing on this milestone and its significance for public healthcare. Over to you, Ankit.
Thank you, Amrita. First of all, I would like to thank the Honorable Health Minister, Mr. Vishwajit Rane, for taking the time to visit us today. I would also like to thank Mr. Praveen Rao, AstraZeneca Country President and MD. I want to thank Dr. Sandesh, CMO and CDC, and Dr. Rupa Nayak, DHS Director, and the entire Public Health Department of Goa for achieving this great milestone. Lastly, I also want to thank all of our media friends here for taking the time to share this milestone with us. On the eve of Lung Cancer Day, I want to firstly draw attention to the problem of misdiagnosis of lung cancer. Almost 40% of lung cancer cases are misdiagnosed as other diseases like tuberculosis. Within the ones that are correctly diagnosed, 80% of them are diagnosed in really late stages where chances of survival are as low as 5%. And given the improving quality of life and which is leading to an even more aging population in India, these incidences of lung cancers are only going to increase. So this project has proven to be a milestone, a guiding light in how we can solve for this early lung cancer detection. What we have done is essentially put AI on surveillance mode throughout the entire public health facilities in Goa. It's important to understand that this is not a new test for the patient or for the hospital. Chest X-rays are anyways being taken for annual health checkups or pneumonia or multiple other diseases. It's a very routine test. What we have done is just make this test much smarter with the power of AI. It's like switching on lights in an already present dark room. We can see much more. Every clinician is empowered with AI, and through that, we have now screened 100,000 people in Goa. To just give a context on that, this is roughly 5% of the entire population of Goa. And it's not just important how many lung cancer cases have we found. It's also important that 99% of these patients and scans have that comfort that they have been screened with AI and no chances of lung cancer have been detected on those scans for them. I also want to draw attention to one very special aspect of this project. If you look at diffusion of any innovation across the world, especially in healthcare, say for example, the first CT machine or the first MRI machine, they must have come to the poshest, richest hospitals in the country or the richest countries in the world first, and then it trickles down to the Aam Janata. Whereas in this project, you will see that the most advanced technology, which is artificial intelligence, is directly coming to the benefits of the common people of Goa, and this couldn't have been possible without the creative and futuristic vision of our Honorable Health Minister, Mr. Rane. This is a very special moment because public health is leading the charge on extremely innovative technological innovation. What we have done today is we have created a highway of AI on chest X-rays. Currently, we are only running a truck called lung cancer on that highway because early detection of lung cancer is what the project was about. And without AstraZeneca support, we couldn't have done it. A lot of hard work has been given by the entire public health team. But the highway is ready. And we are only running a truck called lung cancer today. There is a huge opportunity to run a bus called tuberculosis, a car called COPD, a bike called heart failure. All of these multiple diseases can be detected on the same highway through existing chest X-rays. No new tests, no new infrastructure is needed. You just apply AI as a thin layer on top of existing infra, and a lot more patients can be detected early, a lot more lives can be saved. And Goa, because of that aspect, will become a shining example for the entire country and for the entire world. This is the first time that at such a huge scale we have seen so many scans, so many people being benefited by such a new technology. Now the intelligence in this technology might be artificial, but the dedication and the hard work and the passion that the Public Health Department of Goa has put into this is extremely real. So with that, I would just like to thank everybody and invite Mr. Praveen Rao, the country president and CEO of AstraZeneca, to share his words with the press. Thank you.
Thank you, Ankit, and good afternoon, everyone. It's always a pleasure to be in this beautiful state of Goa, and even more so when it is for such a historic, I think, occasion. When first, at the outset, let me really start by thanking the Honorable Minister to have, first of all, taken the time to be here, but more importantly, for his leadership of that being today possible. Because really one of the big learnings for us anywhere in the world is that to enable change, you need a champion. Only when you have a champion does change happen. And he's been an incredible champion in terms of really adopting a very innovative means of trying to improve public health. It is now proving to be an example, not just for Goa, but I would say certainly for the rest of the country, and is an example potentially for us in the world in terms of how you could take the public health infrastructure in a state and really, with the help of AI, transform outcomes for patients. So, first of all, sir, I really want to take this minute to thank you for your leadership, thank you for your advocacy, and for your partnership for the entire sort of state of Goa. Now, AstraZeneca, of course, is a global pharmaceutical company. You must have, many of you might have heard of us, there used to be once a saying that we are the largest pharmaceutical company nobody has heard of, because we used to be very much focused on prescription pharma rather than consumer pharma. But of course, everybody has heard of it during COVID, because of Covishield, something that we are very proud of in terms of the service that has been able to bring. But cancer is a really big part of our commitment in the context of public health. We dream of one day curing cancer as a cause of death. But certainly, what might have been seen as impossible even 5-10 years ago, with the rapid advancements in science, is no longer impossible. In fact, no longer do most people believe that cancer is a death sentence that it once was. And that is an incredible thing to say, because that offers hope for so many people. But for that to really come about, we need to first detect cancer. And one of the challenges in terms of detecting cancer is that the vast majority of cancers are detected too late for them to fully benefit from the innovation that we currently have available. So one of the goals of this project was that first to actually increase detection overall, and hopefully over time increase early detection. And I think what you see today, the milestone that we are talking about, which is 1 lakh scans, is a big sort of landmark in that context, because we've now been able to take incidental sort of X-rays and identification of nodules potentially, because an X-ray that would have happened anyway. So it's a huge sort of paradigm shift in terms of how you would screen for cancers. And what we are seeing in terms of the early data is that this does sound very promising. Now, a big part of the work that has happened in Goa that I think is so admirable is that it is not just sort of any one team, but the entire public health system under the leadership of the Honorable Minister and his advocacy, as well as all of the physicians and the teams that have worked alongside, have really proven how to do this. A lot of times we've got big ideas, big aspirations, but it really comes down to how do you execute on that. And I think what has really helped, and this landmark is showing us, is that in Goa we've actually figured out how to do that. And this will now serve not only the people of Goa, but this will serve as an example for the country on how we can actually implement this idea of early detection and hopefully early diagnosis of cancer. So this is a super exciting moment. I think all of you should certainly take pride like we are in terms of that this is happening here in Goa. And we are hoping to learn a lot from this pilot and hopefully serve patients not just here but across the country. So with that, again, thank you for the opportunity to be here and for the opportunity to really partner with the state to enable what we all want to do, which is to improve outcomes for patients suffering from cancer. So thanks so much.
Thank you, Mr. Rao. May I please request you to present a bouquet to Honorable Mr. Shri Rane, sir? Thank you. Now I invite Dr. Sandesh Madkakar, Chief Medical Officer, Non-Communicable Disease Cell and Directorate of Health Services, to address the gathering.
Good afternoon, everyone. Myself, Dr. Sandesh Madkakar, Chief Medical Officer, Non-Communicable Disease Cells at Directorate of Health Services, Kampal, Triaging. I warmly welcome our respected Administrator, Sri Vishwajit Rane, sir, for today's press briefing, along with Mr. Ankit Modi, who is a Senior Managing at QREI, and Mr. Praveen, AstraZeneca. As we know, World Cancer Day is observed on 4th Feb every year. This Cancer Day is observed for awareness and better screening. So this year's 2026 theme is You by You, United by Unique, which means every cancer journey is personal with unique medical, social and emotional need. So every cancer is a unique. At Directorate of Health Services Goa, we do screening for breast cancer, oral cancer and cervical cancers. These are done mostly at the non-communicable camps which are held in the urban and periphery. Also at mega medical camps. Our Health Minister is behind this arranging of mega medical camps, and also at routine OPDs at all the 40 health units, including gyms. At Directorate of Health Services, with inspired leadership of our visionary Health Minister, we have launched a lung cancer early detection project using AI chest X-ray software, QRAI device, in collaboration with AstraZeneca Pharma to screen lung cancer cases in Goa. Lung cancer is the leading cause of death today, especially in the younger generation. And early detection and early starting of treatment is the only key. So what is this QRAI? So QRAI is an X-ray interpretation tool which identifies lung nodules. Lung nodule means there is a nodule in the lung. This tool is incorporated in our computerized radiography all over Goa. In 17 centers presently we have incorporated this tool. And this identifies the nodule, the precursor for the malignancy means cancer. So presently it is deployed at 17 centers and also at GMC. The total scans, the total X-rays done till today are 1 lakh, to be precise, 1,08,474. And just imagine, we have found out total suspected nodules are 1,650. So in this, the start of the project until today, we have confirmed 20 positive cases. This is done by, once we get that nodule, we refer the patient to the district and Goa Medical College, where the cases are confirmed by CT scan, HRT CT, and by biopsy. So once cancer cases are confirmed, the treatment is started. The earliest, the better. So presently, 1,650 nodules are under consideration, and all these patients, 20 patients, are undergoing treatment. So in conclusion, QRAI screening detects cancer at a very early stage, and which is the only means for the treatment at the earliest. So early detection and early treatment is the key. Thank you very much.
Thank you, Dr. Sandesh. May I now request Honorable Minister Sri Rane sir to address the gathering?
Good morning to all the dignitaries present here, members of the media, the country head of AstraZeneca, Praveenji, who is here with us today, Ankit from QRAI, our Dr. Sandesh Patkar, Director Health Services, Rupa, and all the other dignitaries present here, doctors. Actually, it gives me great pleasure because, it's a great moment for us here in the state of Goa, just like Mr. Praveen mentioned, that AstraZeneca, because of AstraZeneca and this partnership with QRAI, that we were able to, along with the health services and government of Goa, that we were able to take this initiative forward. Initially, when this came forward, we didn't understand as to what is the type of impact that we have on the people and the population in the state of Goa. Actually, all of us know that the government of India, and with the visionary leadership of our Prime Minister, we have been trying to see how, and if you look at the budget today that has been presented, if you look at the stress that has been given on healthcare, AI has got a tremendous also role to play on utilization of artificial intelligence to see that we are able to diagnosis is more accurate, time is reduced, and we are able to take this forward in a very different way. Basically, when we talk of different type of reformative kind of healthcare system putting in place, AI here in the state of Goa, I think Mr. Praveen has just mentioned, it is their partnership of AstraZeneca with the state government that helped us bring QRAI on board and take this forward. Today, we have been in a position to carry out X-rays and chest checks and check them for lung cancer. I think we have already completed 1,01,000 and odd screenings done of X-ray, which is one of the, it's a big sizable amount. And Goa is one of the first states in the country to initiate this and take it forward. Those small pilots have been done by them in different parts, but we were just discussing how do you basically enhance it and take it to a niche and a level higher. Actually, I'm very happy with this partnership. And I would like the media and all the doctors have been a part of it. I would like to congratulate them also for all their hard work, because it is their contribution and also our contribution and partnership with them to take this forward. It has been very, very successful. We have also targeted that we will complete more than 2 lakh X-ray screening for using artificial intelligence in trying to check more than 2 lakh X-rays in the state of Goa by 2026 end. Actually, when we talk about this, it not only identifies cases of lung cancer, but we have also, in this whole pilot that we have done in the state of Goa, we have been able to identify about 10,500 nodules. Then apart from that, we have been trying to see that it's been helping in reducing time for diagnosis. All this has been a very important system, further building a robust health system so that we are able to response time, to give the treatment or identify the patient and take it forward has been very, very remarkable. Lung cancer is one of the leading causes for mortality, and as a result of which early detection and everywhere. Actually, I have already moved a file. Actually, I don't know whether our team has mentioned, Brazil must have mentioned to you, Dr. Rajendra Desai is also there. He must have mentioned is that we want to notify in every hospital that along with what we have done is with every X-ray that is taken out of chest X-ray, this automatically by default, this screening utilization of AI and this combination is used so that we are able to accurately diagnose the patient and bring it forward. If it requires any additional care, and we need to take it forward. It is important and unique that this scanning that we have been doing and this utilization of AI in the true sense we are moving forward. But I was just told the platform that QRAI is to offer is much more than only on lung cancer, but on several other parameters. But here today, like Dr. Sandesh Matkar has just mentioned, and on the occasion of the Cancer Day and several other initiatives that are being taken by the state government, this initiative is very important for us. So I would like to assure the country head of AstraZeneca, Mr. Praveen, is that the state government would love to further enhance and take this partnership to a different level. It is important for us, along with QRAI and along with your support, the state government will be in a better position to actually create a broad spectrum partnership as far as utilization of AI is concerned. The process, this particular program has been implemented across different centers. Today, from the 9th to the 20th, we have also identified different primary health centers and community health centers so that this scanning and screening can be done and go in an intense manner so that we are able to provide early care and identify these type of problems among the people so that we can take it forward. It is important for us that the AI that I was just mentioning, that like about 10,556 nodules, including 1,600 classified high-risk enabling cases, to enable clinicians to prioritize the patients and take urgent healthcare, whatever protocol needs to be followed. Today, in the state of Goa, which is also known as a very progressive state, and we have been doing these things with partners like AstraZeneca. We all know about the credibility and the credentials of AstraZeneca. We have also got a partner in QRAI. We want to do this and take this forward. Today's this compact event here today, and have been happy to interact. I'll be interacting with them to see what best we can do and how we can take Goa and make Goa a model state across the country. Many times when we have been doing this, we have seen on other screening programs also the Government of India. Recently also I just mentioned to the Government of India of what we are doing and how we are doing. Today also we are having somebody who is directly concerned officer who is directly reporting to the PMO on what we are actually doing in the state of Goa, how we are utilizing it, how we are through partnership with AstraZeneca and QRAI, how we are actually utilization of AI in the area of diagnostics and healthcare and how it is impacting the lives of the patient. It is important for us to see that we move forward. Today, I would just like to mention that 18 confirmed lung cancer diagnosed cases reduced the average time to diagnose these patients by more than 50%. Now, all this, which is there in shortcut, what I would mention to you is that the thrust that has been given by the Government of India of utilization of AI and what role of AI is going to be in the future. And Goa would like to lead the way. And I've already said many times when I was speaking in the assembly also that we would like to do everything that is possible to utilize AI as a tool of diagnostics and take it forward in a very different way and make Goa a diagnostic hub and lead the way in the country to show what all can be done utilization of AI. We are a very small state. Impact can be felt on the patient's life immediately. Also, the load on the doctor and the doctor's diagnosis and accuracy can be also, it can be much more. And this is how we want to lead the way. I'm grateful to AstraZeneca and also to QRAI, for having supported the state government and our state government officials, all the doctors, because without the doctors, this is something that is not practically possible to achieve. And all the doctors and all the healthcare assistants and all the people dealing with healthcare and all the technicians who are there who are helping us actually take this forward. I would like the media to actually take this message across as to what Goa has been doing. All the media from here locally as to what the state government wants to do. And state government wants to actually expand this and take it to a different level altogether. And I think with this we'll be able to save more lives. Ultimately, our objective is to see that we are able to see that this lung cancer, which leads to mortality, that we are able to reduce this mortality by early detection and proper accurate checking and assessing of the patient from time to time. And across the state, we are going to implement this. Today, we are implementing it to 19, 20, in about 18 centers. We will make sure that we are able to scale this up to a different level so that we are able to, have this program on a regular basis and take it and increase and cover up the population that is required. I'm very happy today to be here, and this is something which is very important for us, and this is something that is very important and which has been highlighted in the budget also. Highlighted in the budget in a manner in which I was just actually going through in detail. Actually, yesterday I was talking to somebody and I was just going through in detail that every aspect, Honorable Prime Minister has, Modi ji has actually through every aspect, he has ensured that healthcare verticals can be utilized in different ways, in different segments. And I think we should make use of it. Goa is going to lead the way. Goa will ensure that we are able to take AI and its partnership forward and QRAI and along with AstraZeneca and the Health Department and Health Services in the state of Goa. We will make sure that this partnership moves a long way and Goa will become a model state in the country for utilization of AI and especially in the direction of this for lung cancers. And also we want to make it, basically I was suggesting that it should be notified in such a manner that all these chest x-rays by default we are able to, and I want to be the first state to actually have this notified so that the doctors by default ensure that we do this scanning in a very meticulous manner so that we are able to identify issues and save lives of people. This is a complex disease which is lung cancer is something which is very difficult and tough for families. And when we have a mechanism like this in place, I think we need to scale it up and we will scale it up. Thank you so much.
Thank you so much, sir. With this, we come to the end of the formal function. We are now opening it up to the press for a Q&A session. You can just pass the mic around.
Yeah, hello, this is Gerard here. I wanted to know what is the accuracy of this AI tool when it comes to detecting these early detection of lung cancers?
Is error, margin of error, if there is any.
Hello.
So the software is more than 99% accurate in flagging nodules, and then sort of classifying them based on the risk of malignancy or cancer that can be presented. But again, I would like to stress upon that chest X-rays always are a screening tool, and you have to do a follow-up test to confirm the lung cancer, whether it is a CT scan or a biopsy. The real idea is, can you use existing infrastructure, the X-rays that are already being taken, and then utilize the same to find more lung cancer patients? Right? We are not saying that we will install new X-ray machines, take new chest X-rays for the patients. So there is absolutely zero burden on patients, absolutely zero burden on doctors and hospitals. It's just the same X-ray, but a separate pair of eyes with this AI looking at it from a holistic perspective.
How much lung cancer is there in Goa?
20 are detected after 1,08,000 scans.
So it was 18
Yeah. So it was, the number was 18 for 1 lakh. Now latest addition of 8,000 plus 2 cases we have got. So number comes to 20. So this app is started from March 2025 till date. The duration is less than 1 year.
हे चालूच उरतले आणि हे असोसिएशन एस्ट्राझेनेका आणि किंवा या घड्याळांनी स्केल अप करपाचो आमचो प्रयत्न आसलो. आयज तेंचे कंट्री हेड आमचे कडेन आयिल्ले आसा. तेंचे कडेन चर्चा करून आमी ह्यो विशय फुडें व्हरपाचो प्रयत्न करतले. म्हणून आतां हांवें सांगलें की 9 तारखे ते 20 तारखे पर्यंत वेरियस हेल्थ सेंटर्स आमी प्रिव्हेंटिव्ह गोष्टीचेर आमी लक्ष दिवपाचे पयलींच्यान तेचेर आमी चर्चा आमची चालू आसा. आनी आयज ह्यो गोष्टी फुडें व्हरपाक म्हणून आमची चर्चा आतां जातली. आणि आम्ही हे स्केल अप ऑपरेशन आणि रिलेशनशिप कशें फुडें व्हरपाचो हो आमचो प्रयत्न आसता. लास्ट गोंयची जनतेक आनी तेंच्या जिवनात एक वेगळे तरेचो इम्पॅक्ट आनी वेगळे तरेन ते फुडें व्हरपाचो आमचो प्रयत्न हो आसा. आनी जे सरकाराचे ध्येय आसा आनी प्रधानमंत्री देशाचे आसा तेंचे जे बजेटान तुम्ही उल्लेख केल्यात, तुम्ही पळयतले की प्रिव्हेंटिव्ह मेडिसिनाक चड आनी चड भर दिल्ले आसा. प्रत्येक राज्यात वेगळे तरेन जर फुडें वचपाक जाय तर वेगळे तरेन फुडें वचपाचो आमी प्रयत्न करचे पण गोंय राज्यांत एक मॉडेल स्टेट करपाचे दिशेन व्हरपाचो आमचो प्रयत्न आसा.
मिनिस्टर, तुम्ही माझ्या फायल पुटअप केल्या तुम्ही सगळ्या ऍप्लिकेशन हॉस्पिटल्स डिफॉल्ट स्कॅनिंग करपाक
फायल कसं ते फायल पुटअप केल्याने आम्ही एक डायरेक्शन दिसलें की प्रत्येक एक्सरे करपाक ह्या गोष्टीचे स्कॅनिंग वेगळ्या तरेन करपाची गरज आसा. म्हणजे आम्ही चेकिंग करपाची गरज आसा. पेरिफेरल जे काही एक्सरेची फेसिलिटी सगळीकडे आसा आम्ही हे योग्य तरेन टायमली आम्ही जर हे सगळे गोष्टी आम्ही चेक केले पण त्या पेशंटाच्या जिवनात कितें फुडें त्रास जावं नये आणि टायमली जर इंटरव्हेन्शन जाल्यार तेजें जीवन वाचोवपाक आमकां संदी गावता. खुबशे गोष्टी आहा पूण आयज विशय आमी हेजेर मर्यादीत दवरुया. पण तुम्ही एक लक्षात घ्या आमचे 2 जण हांगा बसले एक प्रजल आरोग्य आसा आनी आमचे डॉक्टर राजेंद्र देसाई आहा. आयज ते दोगांक आनी तांकां वेगळे वर्टिकल्स हांवें दिल्ले आसा आनी आमचे मदीं म्हाज्या वांगडा काम करपाक एक गीता देशमुख पूण एक तिका हांवें सांगला प्रजलान कितें इनिशिएटिव्ह घेतल्या. डॉक्टर राजेंद्र म्हाज्या वांगडा पयलीं डायरेक्टर हेल्थ आशिल्ली आनी आयजची डायरेक्टर हेल्थ जे बरें जगदारांची ती उक्ती दिसता ती उक्ती समजूं नाका ते आहा ते बरें आनी ते म्हाजे वन ऑफ माय फेवरेट ऑफिसर. आणि आमचो डॉक्टर संदेश मडकेकर आयिल्ले आसा ताका आतां स्कोप आमी दिल्या एक ऑडियन्सान बी आमचो केदार बी बसला बरे आमचे कडेन डॉक्टर्स आहा आमचो वाळपयचो हेल्थ ऑफिसर आनी हेल्थ ऑफिसराक आमकां वेगळे तरेन आमी एक्सपोजर दिवपाचो आमचो प्रयत्न करता. तुमी हे जे आमकां सांगता आनी मिडिया जेन्ना विचारता तुमचो अधिकारा विचारपाक किंवा राज्य खंयचे दिशेन दिता आयज जेन्ना देशाचे प्रधानमंत्री विजन की पूर्ण देशान ह्या तरेचे प्रत्येक सरकारान हे अडॉप्ट करपाची गरज आसा. आमचे कडेन जेन्ना पार्टनर्स एस्ट्रोझेनेका पार्टनर्स आमचे कडेन येतात आनी आयज तेंचे कंट्री हेड प्रवीण आमच्या मदीं आयिल्ले आसा. आयज अंकीत QRI जे आयज ते रेप्रेझेंटेटिव्ह आयिल्ले आसा. आमकां हो स्केल अप वेगळ्या तरेन आनी प्रत्येक गोष्टीचो एआयचो जे काही आमी वापरूं शकता तुमी पळयतले फुडले 4 ते 6 म्हयन्या भितर एक गोष्ट वाडोवपाचो आमचो प्रयत्न आसा. पूण आयज हो विशय आमी ह्याच चर्चेक मर्यादीत दवरुया. तुमकां टायमली मागीर आमी ते वयर आमी व्हरपाचो आमचो प्रयत्न आसा. आतांच सांगला तुका नांवां जाय खंयचे 9 तारखेक नांवां ती आसा तेजे कडेन नांवां वाचूंक ना. आयज आमी हे स्क्रिनींग जे आहा ते स्टार्टींग फेब्रुवारी 9 to 20 लंग हेल्थ स्क्रिनींग प्रोग्राम लॉन्च 5 सेंटर आमी वाळपय सांखळी अर्दोना बिचोली चिकाली आनी शिल्बेर सद्या आमी हांगाच सुरू केल्ले आसा. हे पूर्णपणे आमी सगळी कडेन वचपाचो प्रयत्न आसा.
Dr. Madkekar, तुवें ते 20 cases सांगले ते it is within this program, but beyond this, what is the incidence of lung cancer in Goa?
So that incidence is there, but as far as topic is concerned, it is only 20 detected by this end.
Sir, to registry karta you were speaking some time back about having a cancer registry in Goa.
Basically, the cancer registry is in the our मंत्री जेन्ना आशिल्लो तेन्ना आमी कॅन्सर registry गोंयांत आमी केल्ले आसा आनी केल्ले आनी ब्लड टेस्टिंगाक जितले आयले कॅन्सर मार्फत नोटिफाय करपाचो आमी प्रयत्न तेन्ना केलो. हे इन्फॉर्मेशन हे सरकार कडेन घेवपाची गरज आसा. प्रायवेट हॉस्पिटल आसूं काय आनी खंयचे हॉस्पिटल आसूं. This has to come to us so that we have the cancer registry totally updated and we can do. What Dr. Madkekar is saying, he is mentioning that in this program, there may be much more cases. That's why we need to scale up the operation. This was just the beginning. And I'm confident with association with AstraZeneca and with QRAI and with the knowledge that they have got, and I'm talking about AI, utilization of AI, and also with their partnership, we will be able to scale it up across the state of Goa. The reason why I keep saying across the state of Goa because we are a very small state and we have got identified health centers, CHCs. काल तुम्ही पळयले आमी चॅलेंज आमी घेतलेले आसा आमचेरूच घेतलेले आसा की नव्या हॉस्पिटलान जेन्ना आमी ओपन करता त्या हॉस्पिटलान नवे नवे गोष्टी हाडपाचो आमी प्रयत्न करता. पण त्याच बरोबर when we scale it up, we'll automatically be in a better position to see that preventive health care, that focus goes on that and early detection of issues which are there in the patient. We are able to take it, identify it.
सर पुढारा MOU आपलो सर तुम्ही आता जे हे केला MOU आपल्या हेल्था वांगडा
असं MOU शिवाय कशी सरकारचं असेल. हांव विश्वजीत राणे म्हणून ते घेऊन वचू शकना. सरकाराचे नियम आधाराचेर आमी एक गोष्ट फुडें व्हरपाचो प्रयत्न करता. सुरवात आमी केल्ली आणि हे सुरुवात आणि स्केल अप करतोय. This is I is the country head of AstraZeneca is here with us. I am very happy that he comes for today's program, and QRA is also with us. We will make sure that Goa model is followed everywhere. You must remember that न्यूबॉर्न बेबी स्क्रीनिंग असून ती काय इन्सुलिन वेगळे बरोबरी आम्ही दिवपाचो आमचो प्रयत्न असून जे लोकांची जीवनात वेगळे त्यांचे परिवर्तन हाडपाचें काम आमी केलें. एम जातल्यान डॉक्टर अंकुशा भायर हाडलो, एम जातल्यान आमी गोंया राज्यांत आमी तेजो आमी वापर केलो. पूण एक गोश्ट आमी जे केल्लें आसा ते फुडें व्हरपाचो ते सामान्य मनशाच्या जिवनात ते खंय तरी तेजो उपयोग जाल्लो आसा आनी म्हणूनच आमी ह्यो तरेची गोश्टी फुडें व्हरपाचो आमचो प्रयत्न आमचो चालू.
Sir, when you are talking about the Goa model, but some parties leaders criticize.
I don't know, it is not a party. तुझे प्रश्न विचारपाचो फॉरम चुकीचो. तूं म्हाका देवळान येता तेन्ना तूं जाय ते फॉरम हांव खुशी गावता उत्तरां दिता. आयज आमी हो प्रोग्राम एआयची किंवार एआय आनी विथ AstraZeneca आमी केल्या तेजेर आमी उलया. तुमकां एआय संबंधी कितें जाय, राजकारणाच्या संबंधी कितें.
मिनिस्टर बागवाडे कॅन्सर हॉस्पिटल चालू आसा काणकोणांत
पूर्णपणे कंपनीला पीएमओ तेजेर लक्ष दवरून ना आणि पूर्ण 27 पयलीं टाटा मेमोरियल बरोबर आमी फुडें व्हरपाचो आमचो प्रयत्न चालू जाल्लो आसा. आयज सकाळीच हांव मुख्यमंत्री कडेन चर्चा केल्ली आसा की एक मिटींग दवरुया, कारण आमकां ते एक वेगळे तरेन एक सेमी ऑटोनॉमस बॉडी म्हणून आमकां ते फुडें व्हरपाक जाय. आणि त्याच हॉस्पिटलांत इस्रायलांतल्यान टॅक्नॉलॉजी नवी आयिल्ली आसा. देशाच्या सरकाराचे एक इंजिनियर म्हणून कंपनी आहा, त्यांच्याकडे एक पीएमओच्या संपर्कात रावन ते सगळे मॉनिटर करतात की देशात खंय खंय कितें चल्लां आणि ते मॉनिटर कित्याक करतात, कारण तांकां जाय की प्रत्येक राज्य आणि जे भारतीय जनता पार्टीचे सरकार जे प्रत्येक राज्यात जे आसा ह्यो सरकार योग्य तरेन काम इन लायन विथ प्रायम मिनिस्टर शूड गो फॉरवर्ड. सो बेसिकली ते कॅन्सर हॉस्पिटल which we have decided, you must have seen the letter that we had got from the honorable prime minister when we started the OPDs. आमकां हे फुडें व्हरपाक जाय. आमी हॉस्पिटल ऑलरेडी 7 फ्लोराचेर पावले आसा आनी ते फास्ट ट्रॅकाचेर आमी व्हरपाचो प्रयत्न आमी करतले. आनी एक सांगता, आमी हांगा पॅरलली आमचें चालू जाला की ते हॉस्पिटल जेन्ना चालू जातलें मेडिकेशन पासून सगळें आमी टाटा मेमोरियलाच्या पीएमचेर आमी घेतले, म्हणजे आमकां ते सवाय सरकाराक गावतले म्हणजे आमी ते बेनिफीट पेशंटाक फ्री गावतले सगळे. पूण आमच्या सरकाराक कितके आमी वाचूंक शकता म्हणजे बरें मेडिसीन आमी लोकांक दिवपाचो आमचो प्रयत्न.
तुम्ही इनिशिएटिव्ह आता घेत असता, बट कॅन्सर सध्या वाढता का डिक्लाइन जाता गोंयांत?
हांव एक्सपर्ट त्या विशयान
डेटा कोण म्हणटा? डेटा
जो आसा तेज्यान दिसता की आहा सगळ्यांक आमी आतां आयडेंटिफाय म्हणजे प्रिव्हेंटिव्ह मेडिसिनाच्या माध्यमांतल्यान तुजें आयडेंटिफिकेशन बेगीन जाता. पयलीं आमचे कडेन तो मेकॅनिझम येवन नाशिल्ल्यो, एज अ रिजल्ट ऑफ इट आमकां कमी केसीस दिसताल्यो. आयज तुमी सगळे गोष्टी करता. पयलीं थंय आशिल्ले कॅन्सर मार्कर्स, आयज रक्त तपासतना कॅन्सर मार्कराचे करता. हांव तरी दर 3 म्हयन्यान हांव रक्त तपासतना प्रत्येक कॅन्सर मार्करचे प्रत्येक गोष्टी हांव चॅक करता. इतल्याच खातीर की खंय वयर सकयल जर जाल्यार आयज ते म्हाज्या लक्षांत येता की बाबा खंय कितें चुकता, शरिरान कितें आहा ते सगळ्या लोकांक परवडना. आयज आमी गोवा मेडिकल कॉलेजान आमी सांगलेलें आसा खर्च मातसो वाडल्यार आमी कॅन्सर मार्कराचे टेस्ट करपाकूच जाय. जो पेशंट आमकां दिसता की एका करपाची गरज पडटली, पूण सगळ्या योग्य तरेन आमकां फुडें वचपाक जाय. ह्यो सगळ्या गोष्टी आयज वेगळे आयज कॅन्सर मार्कर आसूं काय नवे आयज टेक्नॉलॉजीचो वापर आमी करता. बिकॉज ऑफ युटिलायझेशन ऑफ न्यू टेक्नॉलॉजी, न्यू एज ब्लड टेस्ट, वी आर एबल टू आयडेंटिफाय थिंग्स इन अ मच better way, and more and more things come in the forefront as a result of which we feel that maybe we are feeling that the number is increasing, but that is the way it is, and that is how we have to deal with it.
लास्ट टाइम तुम्ही एक इनिशिएटिव्ह घेतलेल्या प्रत्येक कॉन्स्टिट्युएन्सीत तुम्ही हेल्थ कॅम्प केला, स्पेशली कॅन्सर स्क्रीनिंगाच्या तिथे
ती व्हॅन तुमची
डेटा
आम्ही डेटा आमच्याकडे आसा, सगळे डेटा आमचे डॉक्टर्स कडे आसा ते आमी दितात. कॅन्सर स्क्रीनिंग आमकां खूब उपयोग जाल्लो आसा आनी आमकां कॅन्सर स्क्रीनिंग चालू दवरपाक जाय. आणि हे मोबायल व्हॅन आमी प्रत्येक कडेन आमी चर्चा करून तेंचे कडेन आयडेंटिफाय करून आमी चालू केली. तुमकां याद आसतली की हांव पयलीं मंत्री आसतना 2 वोल्वो बसी धाडलेल्यो आनी ते मॅमोग्राम पासून सगळे गोश्टी आमी दोनी नॉर्थ एंड साउथ आमी व्हरताले. पूण आयज वेगळे तरेन ते फुडें व्हरपाक आयज बदलला टेक्नॉलॉजी आयज वेगळे तरेचे मनस्थितीन आमकां फुडें व्हरपाक.
Mr. Rao, what is AstraZeneca's component in this program, basically?
Can you hear me?
Yeah.
So look, AstraZeneca, as I mentioned, right, so we are a global pharma company, and cancer is one of the areas that we're really focused on. Both in terms of what we're bringing in terms of innovation, of course, in new medicines, but we believe that to improve outcomes in cancer, you have to focus on early detection, because there's huge difference when you look at the 5-year survival, for example, of somebody who is detected in late stage versus early stage. So across the world, we are working on initiatives that will enable us to figure out how to detect cancer early. So Pune and us have been partnered now across the world. Actually, this is one of several partnerships where we want to leverage AI to enable early detection, because it is a global public health challenge. In most parts of the world, not just in India, cancers are detected much later. So that is the problem statement that we are trying to address, and I think we were very appreciative of Goa being one of the states where there is so much sort of enthusiasm on that front.
Any other states other than Goa you're looking at in India?
So Goa, of course, where we've probably got the most advanced, and we're also working with Karnataka. There is some work going on. There's interest in a couple of other states as well. So we are really interested in trying to improve outcomes across the country.
आणि एक सांगता दिल्लीन जाऊन आधी हे युटिलायझेशन आम्ही प्रोग्रेसिव्ह स्टेट प्रोग्रेसिव्ह उडोवपाक प्रोग्रेसिव्ह गोष्टी करपाक आय वेगवेगळे कितें आयले आश्वितांतले जावचे आमी आमचे राज्यान आमी कितें बरें करूंक शकता तेजेरूच स्ट्रेस करया हांव काल एक म्हाका कोण विचारलो हांवें सांगलें वॉट वी कॅन डू गुड थिंग्स फॉर पीपल लेट अस स्ट्रेस ऑन दॅट rather than what anybody else is. And we are doing. I am 100% against. There are many challenges. And those challenges have to be overcome. It's not easy. Healthcare is something which is very dynamic, vast, and we have to ultimately work for the people and see that people are accessible to this type of healthcare.
तुम्ही पळयतात गोंयकारपण गोंयकारांचो गोंयकारा खातीर.